We need to be clear about what's possible here. Can dietary intervention actually reverse existing cardiovascular disease, or just prevent progression? The evidence suggests that aggressive dietary change can reverse certain aspects of cardiovascular disease, particularly in combination with other lifestyle modifications. We're talking about intensive versions of Mediterranean and DASH patterns, not casual implementation. The landmark research comes from several sources. The Lion Diet Heart Study showed that Mediterranean diet after first myocardial infarction reduced recurrent events by 70% compared to usual care, a larger effect than most medications. The Predimed trial demonstrated 30% reduction in major cardiovascular events in high-risk individuals. Ornish's lifestyle program, which included intensive dietary change, showed actual regression of coronary atherosclerosis in some participants. Let's define what intensive means here. We're talking about strict adherence to the most protective elements of both patterns. Sodium restricted to 1,500 milligrams or less. 7 to 9 servings of fruits and vegetables daily. Fish 3 to 4 times weekly, emphasizing fatty fish for omega-3s. Whole grains exclusively, 0 refined grains. Legumes 4 to 5 times weekly. Nuts daily. Extra virgin olive oil as primary fat, 3 to 4 tablespoons daily. Complete elimination of processed foods, added sugars and trans fats. Minimal saturated fat from animal sources. Red meat may be once monthly or eliminated entirely. This isn't casual Mediterranean eating. This is therapeutic nutrition as medical intervention. It requires planning, preparation, and commitment comparable to pharmaceutical therapy. You're restructuring your entire food environment and eating pattern. The mechanisms are well understood. The anti-inflammatory effects of this pattern reduce vascular inflammation that drives atherosclerosis progression. The improved lipid profiles, lower LDL, higher HDL, reduced triglycerides, provide less substrate for plaque formation. The blood pressure reduction decreases mechanical stress on arterial walls. Improved endothelial function helps arteries dilate properly. Reduced oxidative stress prevents LDL oxidation that initiates atherosclerosis. Biomarker tracking becomes essential for intensive interventions. You're monitoring lipid panels every 3 months initially, total cholesterol, LDL, HDL, triglycerides. Blood pressure at home daily. Inflammatory markers like hsCRP every 6 months. HbA1c for glycemic control. Weight and waist circumference monthly. Some physicians use advanced imaging, carotid intima media thickness, coronary calcium scores, to assess actual plaque progression or regression. Working with physicians is non-negotiable for people with existing cardiovascular disease. As diet improves biomarkers, medications may need adjustment. Blood pressure drops might require reducing antihypertensive doses. Better glycemic control might mean lowering diabetes medications. Improved lipids might allow statin dose reduction, though this should be physician-directed. The realistic expectation is that diet can stabilize atherosclerotic plaques, prevent progression, improve symptoms, and in some cases show actual regression. But advanced disease can't be completely reversed by diet alone. Someone with severe multivessel coronary disease still needs medical management. Diet becomes part of comprehensive treatment, not replacement. The DASH sodium trial showed that combining DASH with sodium restriction to 1,500 milligrams produces blood pressure reductions comparable to single drug therapy, about 11 points systolic. For people with stage 1 hypertension, this might eliminate medication need. For those with more severe hypertension, it reduces medication burden. The sustainability question is critical. Intensive dietary intervention requires sustained effort. Meal preparation time increases significantly. Social eating becomes more complex. Food costs likely increase due to higher produce, fish, nuts, and quality oil consumption. But for people facing cardiovascular disease, the choice is between intensive dietary commitment and progression of life-threatening disease. Long-term studies show that adherence to Mediterranean patterns after cardiac events reduces mortality and recurrent events consistently. This isn't quick fix. It's lifelong pattern change. But the evidence shows it works when consistently implemented. The practical approach for someone with existing cardiovascular disease is working with a cardiologist and potentially a dietitian to design an intensive evidence-based dietary pattern, monitoring biomarkers closely, adjusting medications as needed, combining diet with other lifestyle factors, exercise, stress management, sleep optimization, and committing to long-term adherence. The honest message is that diet represents powerful medicine for cardiovascular disease, potentially comparable to pharmaceutical interventions for some patients. But it requires medical supervision, intensive commitment, and realistic expectations about what dietary change can and cannot accomplish.